Hello, everyone, and welcome to today's Bright Talk presentation about the Healthy Northeast Ohio platform. My name is Libby McGraw. I am the Regional Community Health Improvement Manager for Healthy Northeast Ohio at the Center for Health Affairs in Cleveland. I also serve as one of the local site administrators for healthyneo.org, and today I am joined by my colleague in this work, Sarah Szabo.
Hello, everyone. Thank you for joining us. My name is Sarah Szabo. I am a data analyst at the Cuyahoga County Board of Health, and I serve as the data analyst and another website administrator for Healthy Northeast Ohio.
Thanks, Sarah. We are going to go ahead and get started with some slides, and we are going to also have a website demonstration for you today. During this next half hour, we are going to provide you with an overview of healthyneo.org. You are going to hear all about things related to data on the platform. We will be highlighting some resources to share or use with other community partners. And lastly, we will wrap up with some other useful tools and features. As for our objectives today, we will specifically explore data and trends, where and how to create reports and dashboards, how to access various indicators and resources, and how to search in the databases that are available to site users. Here is some background information about Healthy Northeast Ohio. The publicly available healthyneo.org site launched at the end of 2019, and we do utilize the Conduent Healthy Communities Institute web-based platform. Conduent HCI also does largely maintain and curate data that's available through the site. As you can see on the slides, we do serve 9 counties across Ohio, and in the middle of the slide, those are listed out, and those include Ashland, Ashtabula, Cuyahoga, Geauga, Lake, Lorain, Medina, Portage, and Summit counties. This work is made possible through a grant from the HealthComp Foundation in Cleveland and through the support of our hospital system, and public health partners across our region. Healthy Northeast Ohio serves as a neutral population health data repository with access to over 300 health and quality of life indicators available at various geographic levels. These come from about 30 reputable data sources. Demographic variables are also available, which we will preview in just a few moments. In addition to the data, databases and resources are also available and can be used to support community health improvement activities for our partners and site users. Here is a list of all of our partners who we are currently engaged with in this work across our regional footprint. And with that, we are going to move on to the website demonstration portion of this presentation. Okay, so here we are on healthyneo.org. Again, this site can be accessed at healthyneo.org, and it is free and publicly available. There are no special logins or permissions required to enter the platform. The top banner of the page does remain the same as you navigate through the website. In the top left, you will see options to print, to save as a PDF, or to copy a link for whatever page you are on. At any point when you're navigating through the site, if you would like to come back to the home page, you can click on the logo here, and that will bring you back home. And as you can see over here on the right side, an exciting enhancement that we've recently added is that we're recently recognized as a Healthy People 2030 champion by the U.S. Department of Health and Human Services. The navigation bar at the top will help with navigating through the different pages on the site. You can simply hover your mouse to see the various pages that are available. Through our homepage, you'll see different features that are highlighted. We have an option to search for information on the site by data, topic, or keyword. We have COVID-19 information currently featured. We have additional access points for our county-specific web pages, which are available through these buttons. We have a What's New section that is routinely updated with upcoming events, site enhancements, and other data information. We have a monthly data spotlight. And at the bottom of the page, you will see a list of all of our partners. So to show you an example of what one of our county pages will look like, I'm going to click on the raspberry button here for Ashland County, and all of our county pages will look similar to this as well. We do have overview information at the top with just a brief description of the community. We also have some information from county health rankings and roadmaps that are available on county pages. And as you continue to scroll on our county pages, we have a couple of different rows of buttons for various data reports or other tools and resources for that community that are available. The next page that I'm going to preview is our demographics dashboard, which you could access here through the county page, but you can also access it by hovering your mouse over Explore Data and hovering over the Specialty Dashboards flyout, and you could then select Demographics Dashboard. Over 250 demographic elements are available from Claritas on this page. You can view all of them here, or if you would like to click through the different tabs at the top, you could also view those indicators that way as well. This information is available at the state, region, county, and zip code levels, and you could click on the arrow to change the geographic location for what you're looking at. And I'm going to scroll down and you'll just start to see a really nice example of how visually dynamic some of these data visualizations are. And one of the really nice things, which my colleague Sarah will talk about in a few moments, is one of the great features is that you can download and save these visualizations as well. So there is a hamburger symbol in many of our graphs and charts that you'll see throughout the site, and you could click on that to download as a JPEG, as a PDF, or as a CSV file. And these could then be imported into presentations, proposals, reports, and so forth. So that's a little bit about our demographics dashboard. The bottom footer of the platform also stays the same as you navigate through the site, and this is where you could access our topic center. This topic center is a great tool because it helps bring together related content. So if you're new to the site and if you're not sure where to start for exploring different data and tools and resources, this might be a great place to start. So for the sake of our example, I'm going to click on this community icon, and you will see it's bringing together all of the information on the platform related to community. So data indicators, funding opportunities, maybe community resources, and you could then select a different topic by clicking on that drop-down arrow. The footer also includes a couple of other links that we'll point out today. We have some About Us information, a Contact Us page. You can sign up for our newsletter here as well. But one of the other great tools through the footer is our FAQ page. This is maintained by our vendor, by Conduent HCI, but it can be very helpful if you have immediate questions. So our team is available for questions, and you can get a hold of us by email or through the Contact Us page. But if you are curious in the moment and you need clarification on maybe what a definition is or how to cite information, this might be helpful in learning some of that in real time. With that, I am going to turn it over to my colleague Sarah for a deeper look at data and how to search for data on Healthy Northeast Ohio.
Okay, so next I'm going to be walking you through the Explore Data tab on the website, and I'll be showing you the indicators, dashboards, and some data visualization tools that can be used to help tell the story of your community. And as Libby shared, Healthy Northeast Ohio does centralize population health data, and it also enhances the data infrastructure for hospitals, public health, and other community-based organizations. And I just thought I'd share a couple other ways that the data on the site can be used. So it is routinely updated and allows for comparisons and collaboration across sectors. And the data on the site can be used for identifying areas of progress and need in a community. It can also be used for setting priorities and goals and tracking progress against targets and national goals. It can be used for informing program planning and policy and funding decisions, as well as supporting the community health needs assessment and community health improvement process. So I thought I would start by showing you the indicator list by location, and this can be found in the Explore Data tab. This list includes all of the 300 plus indicators that we do have available, and it shows the geographic levels of data that are available for each indicator. You can see that it's organized by topic and subtopic. And I just wanted to quickly mention that the data on Healthy Northeast Ohio is available at the state, region, county, city, zip code, census tract, and neighborhood levels, with most of the data being available at the county level. So I'll scroll just a little bit just to give you a sense of some of the data we have available. Scroll down just a little bit. And I thought I would take a little bit of a deeper dive into an indicator to see how you can learn more. So if you see an indicator of interest, so for this example, I'm going to go ahead and click on life expectancy. And then you'll see that next you're going to be prompted to select a location. So I am going to go ahead and just select Ashland County. So now you're taken to what is called the indicator detail page. And this is where you can read more about the indicator, why it's important. You can see the values for the location you've selected, as well as information about the data source and the measurement period. You can see comparisons to other locations and values, as well as look at change over time. This page also will include a map of the data and then any subgroup data that might be available. And you're going to see that the website does use a variety of gauges and dials and colors. And I wanted to just point out over on the left, there is a see the legend option, which can help you with any interpretation of those. And I'll continue to scroll a little bit. And as Libby mentioned, this change over time graph can be downloaded by clicking the hamburger symbol. If this indicator had breakout data available, it would be showing here, and there would be additional graphs. The maps are also interactive and can be downloaded using that download symbol. And then there will also be a table of the data, as well as an option to download the data to a CSV file. And then towards the bottom, as Libby shared with the Topic Center, the website does do a great job of bringing together related content. So here you're going to see other indicators, promising practices, etc., that relate to life expectancy. Okay, so I also wanted to share that Healthy Northeast Ohio includes several specialty dashboards and curated dashboards. And by dashboard, we really just mean a collection of indicators, and that could be around a topic, a location, or some other element. And in the drop down, as Libby shared, that would be under Explore Data, Specialty Dashboards. And I know she showed the demographics dashboard, so I'm not going to do that, but I did want to mention that the demographics dashboard is one of the most visited pages on our site. So here we are looking at the disparities dashboard. So if you're interested in looking at differences in health between groups, you could use this dashboard to help identify those groups to focus your program and or policy efforts towards. So this dashboard allows you to view indicators that have subgroup data available by things such as race, ethnicity, age, and gender. And you can use it to identify populations who may be disproportionately impacted. And just keep in mind the availability of breakout data does depend on the data source that it's coming from. So in this dashboard, you can see how values differ amongst various subgroups and then how subgroup values might compare to the overall value for a population. And then next, I wanted to show the Healthy People 2030 Progress Tracker. So this shows how a location compares to the National Healthy People 2030 10-year objectives for improving the health of all Americans. And you can use this dashboard to identify needs and priority populations, as well as to help set goals for your programs, and then to compare your community to those national benchmarks. And in this dashboard, you'll see there's either a red X or a green check icon indicating if that target is being met or not. And then in addition to the specialty dashboards, Healthy Northeast Ohio also includes several curated dashboards. And those are just pre-built, customized dashboards that Libby and I can create on the back end of the website. And those can be found by clicking on Explore Data and then search for data and curated dashboards. So these curated dashboards can include indicators that are maintained by our vendor Conduent or local data that we are able to add. And I did want to just highlight that, that is an option on the website to add local data to it. And by adding local data, that really can help provide deeper insights into local issues. And then it also can be sometimes more up to date than data from secondary sources. So we have several curated dashboards around topical areas. So here you'll see like ACEs, digital access, social determinants of health, and those are using data maintained by Conduent that we've just grouped, by those topic areas. But we also have some curated dashboards that we've created that contain local data. So examples of those would be our 2019 Cuyahoga County CHNA dashboard, this Cuyahoga County childhood lead poisoning, as well as this early childhood health and well-being curated dashboard. So another tool that's available within the Explore Data tab is the Socio-Needs Index Suite. So this is a brand new tool that Conduent launched in mid-March, and this is a tool for assessing, planning, and collaborating on community health improvement. And it can be used to identify under-resourced areas down to the zip code or census tract levels. And because this data is available at sub-county levels, it does allow you to be more specific when planning local prevention and early intervention efforts. And in these tools, they each have a map, and you'll see that in the maps, the darker the color, the higher the relative level of need within that community. And there are 3 indices that make up this index. So you'll see those listed here. So the first is the Health Equity Index. If you're familiar with the website, this was formerly known as the Socio-Needs Index, but this is a measure of socioeconomic need that is correlated with poor health outcomes, including preventable hospitalizations and premature death. And this index can be used to identify areas at highest risk for experiencing health inequities. We also have the Food Insecurity Index. This is a measure of food accessibility that is correlated with economic and household hardship, and it can be used to identify areas at the highest risk for experiencing food insecurity. And then lastly, we have the Mental Health Index. And this is a measure of socioeconomic and health factors that are correlated with self-reported poor mental health. And this index not only provides a visual of mental health in the region, but it also can be used to identify areas at highest risk for experiencing poor mental health. And for time's sake, I thought I would just show one of these. So this is the Health Equity Index. And again, this can be used to identify areas at highest risk for experiencing health inequities. So in a nutshell, how this works is that all counties, zip codes, and census tracts are given a national index value that ranges from 0 to 100, with 100 indicating high need. Then those national index values for each location in a community are ranked from 1 to 5, with 1 being low need and 5 being high need. And then there's also this how does it work button if you want to read to get more details. So I'll scroll just a little bit so you can see this map. So here we can see how each of the zip codes in the region are ranked, again, with the darker the blue, the greater the estimated need. And I did want to mention that these maps can be filtered using these options just below the map. So you could look at a particular county's zip codes or census tracts. And again, the maps are interactive, so you can add labels, turn or change the background map and the transparency, and they can also be downloaded. Okay, so lastly, I wanted to highlight 2 tools that can be used to visually represent data on the site, and those are custom dashboards and custom reports. So site users can create these customized data visualizations using these tools to help make sense of the data and also to help tell the story of their community. And then the other data visualizations on the site, including graphs and maps, we already saw on several of the pages that we shared. So we're looking here at a custom dashboard, and a custom dashboard brings together selected data into one place, and it shows a summary of the selected indicators as well as any comparisons that are available. And they can be used to help identify areas of progress and need within your community. They also can help with collaboration because you can easily share these with partners, and it allows partners to use common data for measurement and also for tracking progress. And I think as Libby shared early in the presentation, this tool can also be used to assist with things like reports, presentations, publications, or even a grant application. And then I wanted to mention that these custom dashboards are dynamic. So as the data on the website is updated, your custom dashboard will automatically be updated. So this is a sample custom dashboard I created that focuses on diabetes in Lake County. So I'll scroll just a little bit so you can see. So again, you're seeing the current value for Lake County in the second column, and then to the right, any of those comparisons that are available. So looking at how Lake County might compare to other counties across the state or the country, how it's looking over time, and then if there were healthy people, 2030 targets, if those were being met or not. So now that you've seen a quick example of what a custom dashboard looks like, I'll just quickly scroll up so you could see how I created that. So this tool is available in the Explore Data tab, and you would just click Build a Custom Dashboard. And these dashboards can be built using either the filter indicator option or the handpick indicator option. And the filter indicator option allows you to filter by topics, which is what I've done here, or you can use the handpick indicator option to filter by specific indicators if you've identified those. So really, it's very simple. It's just a matter of using drop downs to add your filters. So this top field here is your location, and you can add multiple locations if that's of interest. And then here you can select the topics you're interested in. And then below that are additional filter options like filtering by a data source, by maybe comparison groups. And then you would simply just click search, and your custom dashboard will then be shown. And I did say how they could be shared. So you can click save a link to the search, and you could copy and paste that URL. Excuse me. Oh, and I also wanted to mention that these custom dashboards can be viewed in a card or a list view. So I'll just click on that icon to kind of show you what those look like. And these cards are nice because you can save individual ones, and they might look really nice, for example, in a PowerPoint slide. Okay. And then the last tool I wanted to share today is the Location Report Builder. So this tool allows you to build customized reports that are based on indicators and then a location of interest. And it is a way to pretty quickly and easily pull together different components on the site into one downloadable PDF. And these reports can also be used to tell the story of your community and can be shared with others as well. And I wanted to mention that custom reports are a snapshot in time. So the data will not be updated in your report like it would be in a custom dashboard. These are more static documents once you create them. And you could create a custom report for things such as a community profile, maybe one that highlights a particular topic area or a priority area. So this is a sample custom report that I created, and it focuses on housing in Lorain County. So you can see that I've added 2 indicators to this report. So severe housing problems and then home ownership. And then within each of those indicators, you can select various components to include. So I've included the indicator card up top, a change over time graph, and then another graph that's comparing the various counties in the region. So now that you have seen a finished product, I'll show you just how to work backwards to create a report like this on your own. So to navigate to the Location Report Builder, you would hover over Explore Data and then click on Build a Custom Report. So here you're going to see your first step is to select a location using the drop-down menu. So I'll go ahead and select Lorain County. And then once you've selected your location, you'll see that this toolbar appears. So your next step then would be to start adding indicators. So I'm going to go ahead and click on this indicators button within the toolbar. So here you can either click or type in all if you want to see all available indicators for Lorain County, or you could do a keyword search. So I'm going to go ahead and type in housing and then click the magnifying glass. So on the left, you're going to see all of the indicators related to housing that are available for Lorain County. And then if you want to select an indicator, so I'll do severe housing problems, then to the right, the various report components are shown that you can add to your report. So this includes things like charts, tables, text, and icons. And a little tip is if you do hover over a component, you'll see a quick example of what that might look like in your actual report. So I'm just going to snag a couple, again, just for example's sake. And then you would go ahead and click Add. and that will add those components to your chart. And over to the right, you're going to see there's an edit and a preview mode. So while you're in edit mode, you can customize your report. So you can do things like edit text, you could delete components, you can adjust the size by dragging and dropping, you can even rearrange the order of components. So if you wanted to add additional data, you would just click on indicators because you do have to add that one at a time. And then you can see you can also add demographics data, health equity index data, a map of the location you're looking at, a legend, custom text, and then some of these divider lines. Once you're finished with your report, to save it, all you need to do is just click on the save icon in the toolbar. And then the only other thing I wanted to mention is if you wanted to get a better idea of your finished product, you could just click preview mode and it takes those edit options away. It's a little bit cleaner just to get a sense of what that finished product might look like. So that covers the data related tools we wanted to share with you today. So I'm going to go ahead and turn things back over to Libby, who's going to highlight a few other tools and resources available on Healthy Northeast Ohio.
Thank you, Sarah. So now that you have seen a lot of the data that is available on Healthy Northeast Ohio, we are going to demonstrate some of the additional tools and resources that might help with some of your program planning. I'm going to take just a few minutes to review these tools and resources that are available in the Tools and Resources tab. The first one that I'd like to call your attention to is the Promising Practices page. And this is a database that is maintained by our site vendor, by Conduent HCI. And with it, you have access to evidence-based practices, effective practices, and good ideas for community health improvement activities. You can learn all about their ranking methodology by clicking on the link that's available right here. In addition, if you are currently conducting a practice that would be a good fit for this database, we highly encourage you to submit that through the Submit a Promising Practice button that's also available here. This Promising Practices database has over 2,000 programs, and that can be quite a lot to comb through. So we highly recommend also using filter options that are available on the right side of this page. So again, you can see here in the entire database, there are over 2,000 results. So let's narrow that down a little bit. So for this example, I'm going to use the keyword search option, and I'm going to select food insecurity. You can also filter based on ranking. So for today, I'm going to filter by evidence-based practice. There are some additional filter options that are available, such as target audience, maybe geographic type, but for the sake of example, I will leave it at what we've just selected. And you can see that that has shrunk the total down to about 53 results. So that still could be quite a few to comb through in one seating. So if you would like to save a link to this search, you can also do that. And you can either share it with a colleague or save it for yourself and come back and visit it later. You can click on a program to learn more about that promising practice. By clicking on that, some overview information is available. The goal, the impact, any results that were affiliated with that practice are also available here. And if you continue to scroll on these pages, one of the great features that I think could be valuable to those who are working in program implementation is the primary contact information for perhaps the entity or individual who submitted that. And as you continue to scroll through, you'll see another example, as we've pointed out a couple times today, of where you can find some related content. So since the program we are looking at is related to food insecurity, you can see that the website has brought together data indicators related to that. In addition, it has brought together some resources, webinars, also just any additional information on the site that is available related to that. If you scroll up to the top, and again, this will remain consistent as you're navigating through different practices, you will see related promising practices. So if you want to continue that search for the right fit for your program, you could continue to do that through here as well. I will briefly mention some of the other tools and resources that are available on Healthy Northeast Ohio. We do have a COVID-19 resources page, which includes some overview information about COVID-19 data, and there are also some links for hospitals and health departments there. Our Vaccine Ambassador Toolkit page is a website page that we created in conjunction with some of our local partners who are working to address vaccine hesitancy. We also have a web page dedicated to emergency preparedness resources and information. Funding opportunities are also available under this tab, and these are mostly national and federal announcements. 211 resources can also be found here, in addition to a community health needs assessment guide. This is maintained by our site vendor, and it is in essence a step-by-step community health needs assessment guide for assisting with planning efforts. So finally, the last page that I will take you to through the Tools and Resources tab is our resource library. This library contains nearly 400 toolkits, site links, presentations, reports, infographics, and other related documents. And we do maintain this locally and have the capacity to upload resources from partners. So if you do have a resource that you are interested in submitting, you can click on the link here. By clicking on this purple icon on the right, you can expand the search option. And again, this is a filter. These filters are similar to what we just examined in the Promising Practices database. And again, this could just help with narrowing down that search. You can also use the search bar and to search for resources by keyword, or you could view our resource collection. And this is essentially collected resources that are similar by topic. So if you knew, for example, that you were really interested in looking at information about health equity, you could click on that resource collection and it would pull up all of the resources we have available about that topic. And that concludes our overview of our tools and resources. As we head into the conclusion of this event, I would like to briefly mention our Learn More tab, which is where you could find some additional information about us, about our team. We also have a How to Use This Site page, which includes information about our efforts locally, regionally, and we also have some video tutorials that are available there. And as a reminder, you can also contact our team through the Contact Us page. All right, if you have any questions or requests, or if you are interested in a Healthy Northeast Ohio presentation, we do invite you to contact our team directly, and you can do that through email or again through the Contact Us page on the website. In summary, the Neutral Data Repository through Healthy Northeast Ohio has many data tools and other resources for supporting community health improvement. And the site can assist with understanding a community, exploring and prioritizing health needs, visualizing data, and ultimately taking action and influencing change. I would like to briefly share our contact information in case you would like to get in touch with us directly. And that concludes our webinar presentation for today. So we thank you for your time and attention, and we welcome you to Healthy Northeast Ohio.
Thank you.